Welcome to Approach to ABGs Part 8, Compensation Rules. We're going to cover the rules that govern compensation. What is compensation? Compensation is the effort by the body to normalize the pH. So when there is a primary or initial osis process causing an anemia, the body will activate a secondary compensatory osis process to try to balance off the primary one. So for example, if there was a primary acidemia, the body will activate a compensatory alkalosis process to try to balance that off. And if there were a primary alkalemia, the body will activate a compensatory acidosis process. So there's a few rules in understanding the basics of compensation. Probably an obvious one to you is that an acid process is compensated by an alkali process and vice versa. Obviously, if you had an acid process and another acid process, as we've talked about in earlier podcasts, they're not going to balance each other off. So a primary acidemia is always compensated by an alkalosis process, and a primary alkalemia is compensated by an acidosis process. Another basic rule is that a metabolic process compensates a respiratory process and vice versa. So you can't have a primary metabolic process and a compensatory metabolic process. So even if you had a primary metabolic acidemia, it cannot be compensated by a metabolic alkalosis process. It would have to be compensated by a respiratory alkalosis process. And if you had a primary respiratory alkalemia, for example, it cannot be compensated by a respiratory acidosis process. And to further drive this point home, you can't hypoventilate and hyperventilate both at the same time. It's physically impossible. So the compensation process, the metabolic, is always the opposite of the respiratory and vice versa. Now, probably something that is going to be the most confusing, the hardest one to wrap your head around, is the degree of compensation. And we're going to have a couple podcasts in the future, but I just wanted to start you thinking about how much compensation should you expect. So remember, the white zone is normal, 735 to 745. And if you had a patient with an acidemia process, the compensation is going to try to move the pH towards normal, just like that. A full compensation never corrects the pH all the way. You see how the little man there is still in the acidemia zone. His pH is still just a little bit less than 735. This is normal compensation. It undercorrects. If we had a patient with alkalemia, a primary alkalemia process, correction is going to bring that pH towards normal. But even at the maximum amount of compensation, it's not going to bring the person all the way to 7.40. Almost always, a compensated patient is still in the alkalemic or acidemic zones. Only rarely will they enter the white normal zone, and never will they cross the 7.40. So those are the rules for compensation. Compensation process never overcorrects and almost always undercorrects. So that means if you had a perfectly normal pH, which is 7.40 or very, very close to that, it was not obtained with compensation. In fact, if you have a normal pH, you most likely have two different primary processes. So we would not label one of them as compensatory, we would label both of them as primary. And we'll go over this in more detail in future podcasts. But this single detail creates an enormous amount of confusion. So I just want to try to plant a seed before we go forward and do some more examples. The bigger osis process creates the anemia. And this is the primary process. So if you had a respiratory process and a metabolic process and they were in opposite directions of each other, and you wanted to know which one is primary and which one is compensatory, you have to look at the pH. And if the pH is acidemia, then whatever process was acidosis is going to be the primary process, and the other process, which would be an alkalosis process, would be the compensatory process. And again, we're going to have some examples coming up in the next podcast that drives that whole concept home a little bit easier for you. So when you have two different osis processes, you need to look at the pH to determine which one is bigger, because this is the primary one. So when you have an acidosis and an alkalosis at the same time, if you have acidemia, which is a pH less than 7.35, you have a primary acidosis. If you have an alkalemia, pH greater than 7.45, it's a primary alkalosis. So just a quick summary of the basic rules of compensation. The process of compensation, respiratory versus metabolic, is always the opposite of the primary abnormality. The acid-base direction of compensation is always the opposite of the primary abnormality. Look at the pH to determine what the primary abnormality or process is. Remember that compensation usually undercorrects and never overcorrects. And if you have a normal pH with two opposing processes, you have two different primary processes. So not a primary and a compensatory, but rather two primary processes. These rules are very important, and the topic of compensation is typically what creates the most confusion for ABG interpretation. So make sure to memorize this list of rules.